Bismillahirrahmanirrahim. Starting with the name of Allah Almighty. Hope you all will be fine. In this video, we will discuss vertebral column. Vertebral column, also known as backbone or spine. Rod shape, front view straight, side view S-shaped, vertebrae singular term, vertebra plural form, vertebrate animal, those animal which have spine known as vertebrate animal. Invertebrate animals, those animal which have not spine called invertebrate animal, such as snake, butterfly. Bones in vertebral column 26, disc 23, total curve in vertebral column 4, first two primary such as thoracic and sacrum because they develop after the fetal development. Second two secondary curve such as cervical and lumbar because they develop after the development of body. Primary curve known as camphotic. Present during the fetal development. Secondary curve known as lordotic because they form after the delivery. Vertebral column located within axial skeleton make up to fifths of your height. 71 centimeter long in adult man, 61 centimeter long in adult female, made up 33 bones in youth. Bones are classified as irregular bones. 24 bones are mobile, further divided into 7 cervical, 12 thoracic, and 5 lumbar bones. 9 fused bones divided into 5 sacral and 4 coccyx. We remember mobile bones by this mnemonics. Breakfast means 7 a.m. means 7 cervical bones. Lunch 12 p.m. means 12 thoracic bone. Dinner 5 p.m. means 5 lumbar bones. S1, S5 sacrum 5 fused bone. Coccyx 4 fused bones. Function of vertebral column: protect spinal cord, body, spine flexibility, shock absorber. During jumping, weight of the head allow attachment muscle and ligaments. Side view show 4 slight bends. Cervical and lumbar curve are convex shape. Thoracic and sacral curve are concave shape. Fetus has singular interior concave curve. Fetus has singular interior concave curve at about 3rd month when infant begin to hold its head erect. Cervical curve develop when the child sit up, stand and walk. Lumbar curve develop. I again explain vertebral column known as backbone or spine. Rod shape, frontal view straight, side view S-shaped, singular term vertebrae, plural term vertebra. Vertebrate animal having spine known as vertebrate animal. Invertebrate animal not spine present. Total bones in vertebral column 26, disc 23, curve 4, 2 primary and 2 secondary. Primary because they develop during the fetal development. Thoracic and sacral. 2 secondary, cervical and lumbar because they develop after the development of body. Primary curve known as camphotic present during the fetal development. 2 secondary curve known as lordotic develop after the delivery. Vertebral column located within the axial skeleton make up to fifth of your height. 71 centimeter long in adult man, 61 centimeter long in adult female. Made up 33 bones in youth. Bones are classified as irregular bones. 24 bones are mobile, further divided into cervical, 7 cervical, 12 thoracic, and 5 lumbar bones. 9 fused bone further divided into 5 sacral and 4 coccyx. Fetus has singular interior concave curve at about third month when infant begins to hold its head erect. Cervical curve develop when the child sit up, stand and walk. Lumbar curve develop. In vertebral disc forms strong joints and permits various movement during day. Disc compress. We are bit shorter at night. During day, disc compress. We are bit shorter at night. While we are sleeping, there is less compression so that we are taller when we awaken in morning. While we are sleeping, there is less compression so that we are taller when we are awaken in morning. With age, nucleus pulposus hardens and become less narrowing of the disc and compression of the vertebra result in a decrease within height. Nucleus pulposus gel-like center of intervertebral disc and is comprised of a mixture of water, collagen, and protoglycans. Nucleus pulposus gel-like center of invertebral discs and it is comprised of a mixture of water, collagen, and protoglycans. Nucleus means central part of something and pulposus means pulp. So this center of invertebral disc annulus fibrous surround the nucleus pulposus in a series ringed fibrous cartilage layer, which is what the word annulus means, ringed shaped. Fibrous means refer to the fibrous nature of the thing, which consists of type first and two cartilage. Layer of the annulus fibrous with fibers at alternating crisscross X pattern. Layer of annulus fibrous with fibers at alternating crisscross X patterns. In vertebral foramina, typical spinal nerve may become stenotic loci of the clinical interest. Two processes component. Body, vertebral notch, vertebral arch processes several component consist two pedicle, superior notch consists inferior notch, two lamina and one spinous process. Total process 7, transverses 2, articular 4, two pedicle, superior notch and inferior notch, lamina 2, spinous 1, process 7, transverses 2 and articular process 4. In invertebral foramina, C1 known as atlas, total cervical 7. Cervical derived from the word cervix means neck or tube. Provide most mobility by the cervical. First 6 vertebra include transverse foramina, skull attached with C1 or atlas, joint between them known as occiput. Atlas and occiput both form atlas occipital joint, vertebral artery present between them pass foramina transverse from C1 to C6, not through C7. C1, known as atlas, word cervical derived from cervix, means neck or tube, provide most mobility. Provide the cervical. First six vertebrae include transverse foramina, skull attached with C1 or atlas joint. Between them, known as occiput. Atlas and occiput both form atlas occipital joint. Vertebral artery present between them passes foramen, transverse foramen from C1 to 6x, not through C7. Foramina transversus passes through from basilar artery. Function of basilar artery provided oxygenated blood to the brain stem. In C1, during hanging, dance is broken. Attachment provided between the ribs, muscle attachment, vertebral artery passes through it. Through this body, move cervical. Through this body, move total DNS in C1, 6, upper part of C1, no disc lies between them. C1 ring shaped and attached directly to your skull. Allow you to nod your head. C1 is able to pivot on C2. No body present between them. Lateral mass also present. Two arches, interior and posterior present. Tubercles, interior and posterior also present. C2 axis present in DNS. Cervical vertebrae facets nearly horizontally allow for the most movement of allow vertebral region, extension, lateral flexion and limited rotation. Short C2 and C6 are bifid shape. C1 smaller transversus foramen than other cervical vertebrae. Long spinous process can fit it along with the midline of neck. Thoracic vertebra consist 12 bones, also known as dorsal T1 or D1, represent 12 vertebra, 12 bones attached, 12 DNS present. Sternum attached to the front side of ribs, back side attached with vertebral column. Parts of sternum, manubrium, body and xiphoid process. Sternum is a flat bone. Angle of Lewis present between the sternum 163. T-shaped vertical bones that form interior posterior of chest wall centrally. First rib known as two rib because they directly attach to the sternum. False three pairs because they not attached with sternum. 11th and 12th pair known as floating ribs because they do not reach to the body parts. Thoracic vertebra provide protection, heart and lungs. Costal facet, body and transverse processes are present. Vertebral foramen is small. Vertebral borders become larger. Spinous process slants inferiorly. Upper half thoracic like and lower like lumbar shape. Body and pedicles larger and thicker. Shorter, more horizontal. Spinous process. Most commonly fracture vertebra. Thoracic vertebra most commonly fracture vertebra. Movement between T12 and L1 lumbar first or provide flexion, extension and not rotation. Thoracic vertebra increase in size. Down the column look like grey hairs. Larger and stronger than the cervical. larger and stronger than the cervical. In lumbar, 5 bones are present, represent L1, L5. 5 in lumbar, 5 bones, 5 dents, and 5 vertebra present. Small vertebra provide more mobility, large vertebra provide less mobility. Most greater size vertebra, lumbar, most greater size vertebra, most bearing weight of the body. In lumbar, two curvature, primary and secondary, are present. Lies lower back, massive, thick body. Massive, thick body are present. Transverse process extend laterally. Spinous process short, broad, and sturdy. Spinous superior articular facet in sagittal plane, facing medially and posteriorly. Inferior articular facet also in the sagittal plane, laterally and interiorly. Strongest and largest of the unfused bones in the vertebral column. Lumbar is the strongest and largest the unfused bones in the vertebral column. Sacrum, also known as sacral, consists 5 bones, in which total vertebra 5 bones. 1 connect vertebral column to lower limb. Sacrum connect with ilium, form sacroiliac joint. Between them help in delivery. Sacral vertebral begin to fuse individual between 16 and 18 years of the age. Process is completed by 13 years, located between the lumbar and coccyx. Right part develop into the hip bone, provides stabilize pelvis and transfer weight of the pelvic girdle, makes border of the pelvic inlets. S5 do not have a spinous process nor lamina. S5 do not have spinous process nor lamina. Coccygeal coccyx consists 4 bones, also known as tailbone. 4 vertebra and 1 bone present. First 6 months during birth. Spine shape is C shape. In spine, 4 curve present, 2 lordosis and 2 kyphoses. Lordosis means front concave and back front convex, front concave shape. Kyphosis, front concave and back convex both view by the side portion of the coccyx. Cyclosis, S shape by view front side. Coccyx is a triangular shape formed by the fusion of 4 individual of the vertebra. Thank you for watching this video. I hope you understand this lecture clearly.